So hello guys, this is Dr. Etisham, and in today's video I'm gonna talk about a very high yield topic, especially for your step 1 exam and other medical board exam, that is efficacy and potency. So that's a very easy topic, but at the same time it's a very difficult to understand, especially the effect of different competitive, non-competitive inhibitor on the efficacy and potency of the drugs. So to understand, I have taken headache as an example and have graded it 100% for the sake of understanding. Usually headache, there is no grading for the headache. So let's suppose there are two drugs. One is first we understand efficacy. So what is the efficacy? It's basically the response. Let's suppose there is two drugs. One drug decrease your headache by 50%, other drug decrease your headache by 70%. So it's mean that this drug has high efficacy compared to this drug. Now come to the potency. Potency, it is the maximum concentration of a drug. Remember, potency is the concentration, efficacy is response. So maximum concentration of a drug at which half of the maximum effect is produced. So now what does that mean, half of the maximum effect? So now let's come to this example. There are two drug A, drug B, and let's suppose when you take the 5 milligram of drug A, your headache decreased by 50%. So what is half of the maximum effect? The maximum effect, maximum desirable effect is 100%. This is what we want to achieve. We want to relieve our headache by 100%. But what is the half of maximum percent? The half of this maximum effect is 50%. Understand? If you understand, let's suppose the 5 milligram of drug A decrease your headache by the 50%, but the 7 milligram of the drug B also decrease your headache by the 50%. So both the drug are decreasing the headaches, like they are just acting at a half of maximum effect. They are decreasing your headache by the 50%. But the drug A concentration is 5 gram, while the drug B concentration is 7 gram. So it's mean drug A is highly potent than the drug B. And how this happen? Let's come to the molecular level. Let's suppose we'll take each gram equal to 1 molecule. Let's suppose there are 5 grams, so we will just take 5 molecule for the sake of understanding. And each molecules basically binds at the 5 receptors, and each molecule is decreasing your headache by 10%. So there is a 5 molecules, each molecule decreasing your headache by 10%. So each molecule decrease headache by 10%. Total decrease in the headache is the 50%. Now let's suppose the drug B, usually you require the 7 milligram of the drug B to decrease your headache by 50%. So how? Just because when each molecule bind at the receptors, they decrease the headache by 7%. So they totally bind at the 7 receptors, and the decrease in the headache is again 50%. Like same response, their response is same. So both the drug have the same efficacy, but drug A is more highly potent than the drug B, just because they have a low concentration of drug required to decrease the headache by 50%, while the drug B required higher concentration. And remember the one important concept: both of these receptors, both of the cell are same. It is just the property of the drug. Let's suppose they act on the same receptor, decreasing the drug headache by 10%, while the another drug acting on the same receptor, same cell, they decrease the headache by 7%. So now what we concluded that the drug A is more potent than the drug B, because the lower concentration of the drug A is required to produce half of the maximum effect, that is 50%, while the higher concentration of the drug B is required to produce the half of the maximum effect. So like they reach the same response, they reach that is the 50% decrease in your headache, but their concentration is different. So the drug A is highly potent than the drug B. And now I've run it on the graph. Like you can see, this graph is for the drug A, this is for the drug B. Drawing this thing on the graph, like this graph is for the drug A, this is for the drug B. Both are producing the same effect, and what this is the half of the maximum effect. Like you can see on the y-axis, this is the effect, that is the response, and this is the concentration, that is the potency. So you can see that this is the concentration, like this is the concentration at which half of the maximum effect is produced by the drug A, while this is the concentration. Let's suppose in the above example, this is the 7 milligram, this is the 5 milligram. So this is the concentration at which the drug B is producing half of the maximum effect, and this concentration at which half of the maximum effect is called the ED50, effective dose for that drug. So let's suppose ED50 for the drug A is 5 milligram, and the ED50 for the drug B is 7 milligram, because at the 7 milligram they are producing the half of the maximum effect, while the drug A is producing the same response at a 5 milligram. So that's why, and you can see the efficacy of both the drug is same, like both the drug at the end produce the same effect, even when you keep on increasing, so that you want to achieve the desirable 100% effect. still you will reach this point. So it's mean both the drug have same efficacy, but just their concentrations required to relieve your headache is different, their potency is different. This is the purpose. That's why we learned the previous concepts to understand these things. What is the effect of the competitive, non-competitive inhibitor on the potency and efficacy of a drug? And this is an extremely high yield, and I have seen a lot of MCQs in the U world coming from these topics. So if you have understand the previous concept, now it's going to be super easy for you to understand this thing as well. So let's suppose first we will discuss the effect of competitive reversible inhibitor. Let's suppose we have a competitive reversible inhibitor X. So what will be the effect of X under drug A? Now we will take the drug A from the previous example, from the previous slide, and we will just study the effect of drug X under drug A potency and efficacy. Let's suppose again the same cells, and the drug X reversibly block the receptor, five receptors that have been blocked by the drug X. So now you require the 10 molecule of the drug A. Previously we required 5 molecule of the drug A to produce the 50% in your 50% decrease in your headache. Now you require the 10 molecule. So why it is so? It is just because the 5 molecule of the drug A will reversibly compete with the drug X, and they will remove the drug X. When you keep up increasing your drug M concentration, they will remove these things. They will compete with the drug X and will remove. Here you can see the drug X are bind with the receptors. When you give the 10 molecule, like you increase the concentration from the 5 molecule to a 10 molecule, they basically replace the drug X, and here you can see they have been replaced and they produce the same 50% decrease. But here now you can see that the potency has been decreased just because now you required a 10 molecule. Previously you required 5 molecule to produce the 50% decrease in your headache. Now you require the 10 molecule to produce the same effect, while the efficacy is not changed, just because the same effect has been produced, that is the 50% decrease in the headaches. That's what we produce in the previous slide, like we produce the same effect with the 5 molecule of the drug A. And here I have written this so that it's become easier for you, like 10 molecule of the drug A is required, 5 replace the X and 5 bind with the receptors, each producing the 10% decrease in the headaches. So other word you can say that now 2 molecule of the drug A is required to produce the decrease in the headache by the 10%. So total of 10 molecule is required. So now you require the higher concentration of the drug A. That's why its potency has been decreased, but its efficacy remained the same because the same response has been produced. Now come towards the competitive irreversible inhibitor or non-competitive inhibitor. Both of these receptors, both of these drugs basically permanently block the receptor. So let's suppose here is the example Y. So Y is basically bind with these two receptors. So it's mean they permanently blocks. When they permanently blocks, they no more exist. They are no more function. That's why they are degraded by the cell. So in other words, you can say that now you have just three receptors. So when the drug A basically bind, each of them will still produce a 10% decrease in your headache. So you have a normal potency. How the potency is normal? Just because each of the receptor, like the intrinsic property of the drug is remain intact, and each of the drug is producing 10% decrease, each of the molecule is producing 10% decrease. So the three molecules, three receptors, they will produce 10% decrease in the headache, but the efficacy has been decreased. Why the efficacy has been decreased? Now no matter how much you increase the concentration of the drug A, the efficacy will not be increased by more than 30%. This is just because you have no more functional receptors. So that's why the competitive irreversible inhibitor or non-competitive reversible inhibitors basically decrease your efficacy, but your potency is unchanged. And a very easy mnemonic to understand and remember this thing is right. Like reversibles inhibitors basically decrease your potency, while irreversibles and non-competitive decrease your efficacy. I hope this this thing help you and understand the concept that what I wanted.